Hi, my name is Boon Lim. I'm a consultant cardiologist based at Imperial College London in UK, and I lead the clinical service for autonomic testing and tilt table testing in the Imperial Syncope Diagnostic Unit. So I'm going to try and address the question, what is POTS? POTS stands for postural orthostatic tachycardia syndrome, and the words just mean or encompass a collection of words which means postural orthostatic. Those two words means a change in posture. Tachycardia means a heart rate increase greater than 100 beats per minute, and syndrome is a syndrome. But the principles of treatment is to understand what triggers or drives POTS, and most of us listening to this would have had some form of COVID or vaccine injury over the last few months or years and have developed this autonomic response. So the autonomic nervous system is that bit of the brain that controls the fight or flight response versus the rest and digest. And oftentimes the autonomic nervous system is not calibrated correctly after the initial insult from the COVID infection. So POTS is when your blood pressure typically and blood volume is typically a bit lower, although not necessarily all the time. But when you stand up, it creates a shift. So gravity creates a shift from which pushes the blood from your head and your heart down into the lower limbs. That's why it's gravitationally and mediated by standing. And this shift triggers an emptying of your heart because the blood is literally pooling in your boots. Your heart needs to respond, and it sends a signal to the brain to activate the fight or flight response, and that in turn surges you with cortisol and adrenaline. These are active, sympathetically driven hormones that push your heart rate up, give you a sense of palpitations, but as well as that, give you the multitude of effects of adrenaline, such as shortness of breath, lightheadedness, feeling anxious and tremulous, getting sweaty, feeling hypervigilant, being aware of your surroundings, and being sensitive to, say, light or sounds, having nausea and having gut symptoms alternating between diarrhea and constipation, having temperature dysregulation. So there's a lot going on because the activation of your sympathetic nervous system, that bit of the nervous system that controls all the automatic functions that we don't normally have to think about, goes into overdrive, shifted towards the sympathetic or the fight or flight response. And that is the fundamental way in which we have the multitude of symptoms that characterize POTS. So thinking about the mechanism of blood pooling in your lower limbs, you can think of a few conservative strategies. So we'll probably try and stick to that and not drugs. But the conservative strategy number one is have plenty of fluids. So know what your blood pressure is, and if it's low or low normal, generally anything below 120/80, then maintain high fluids, probably front loaded. So you take it first thing in the morning and at lunchtime, and try and get 3 liters in by about 7 or 8 p.m. by dinner time. You don't need that much fluids before you go to bed because you don't need to be passing urine all night. Similar with salt. How much salt should you have? 2 teaspoonfuls, about 10 grams. Again, make sure that your blood pressure is within a normal or a low normal range before you double down on salt. And you can also try isotonic electrolyte drinks, particularly helpful first thing in the morning, or when you're trying to exercise and you have these dizziness episodes that sap your energy and fatigue and create fatigue when you're trying to do upright exercises. So these are things like hydration tablets that you might get in a health shop, where you could do, where people who are training for the marathon take in their Camelback backpacks. So this question is quite an interesting one, and it's an observation that is coming more and more to light. There is a connection between hypermobility, in particular patients who have ehlers danlos syndrome, a particular form of hypermobility, and orthostatic intolerance and POTS, and particularly in the long COVID population. I would say up to 50% of patients who suffer with long COVID have a degree of hypermobility. Now the question is why? Why is it when you have bendy joints and you're hypermobile and have stretchy skin that you might have an exacerbation of your long COVID experience with a tendency to develop POTS? Now the answer is quite complex, but I'll try and give you it in a brief summary. If you're hypermobile, your blood vessels which contain the fluid which is the blood. And for example, if this is your femoral vein and this sits just by your thigh, and this is a bottle or a vein full of fluid, now if you're a patient without hypermobility, the collagen around this vessel is pretty tight. So when you stand up and blood falls down, it would just fill up this container, and the container, your blood vessel, will not expand so much. Now, guess what? If you're hypermobile and you have a similarly size initial blood vessel, your blood vessel is like a balloon that has been blown 100 times. So in other words, it's very compliant. And when you stand up, instead of losing, say, 400 mils with gravity, if you were not hypermobile, you could lose a liter per leg or 800 mils per leg, because this blood vessel really expands and accommodates all the blood that continues to pull down. Now, this hypermobility and the vascular compliance, which is very big now in your lower limbs, but also in your splanchnic bed, which is the gut capillary bed, which can be unfolded to the size of a tennis court. These are the capillaries and the major veins in the blood vessels that can open up and literally suck the blood away from your head and your heart whenever you stand up or whenever you have a large meal.
This is part of a series of videos I'll be sharing where experts answer your questions about ME/CFS and long COVID. It's been created in partnership with Turnto, a free app which is basically a ginormous database of information about ME/CFS and long COVID. It covers the most recent research, treatment reviews, and has experts sharing their words of wisdom. If you want to watch an extended version of this interview, find out what other experts are coming up, and submit questions to them, then download the Turnto app. I've put a link in the description so you can go and check it out now.